let us see in simple words what dysplasia is all about. We have all heard about neoplasia, which is the term used for cancerous conditions. Dysplasia is nothing but the histological term used for precancerous condition. Dysplasia is most commonly encountered in the epithelium. Therefore, it is also known as the epithelial dysplasia. And by definition, dysplasia comprises a loss in the uniformity of individual cells as well as a loss in their architectural orientation, that is, their arrangement. Now, what causes dysplasia? Dysplasia is usually associated with chronic inflammation, irritation, or chronic subclinical infection. But the good thing about dysplasia is that it is reversible. And therefore, when the underlying stimulus is removed, the dysplastic alterations which are seen will revert back to the normal. So, what are the dysplastic features which are seen histologically? We will see the classical features of dysplasia given by Kramer et al. In 1978, though some features have been modified by World Health Organization later. The first feature being the loss of polarity of basal cells. That is, the basal cells of the epithelium have a tendency to have their nuclei near their basement membranes. In dysplastic conditions or neoplastic conditions, this nuclei tend to move away from the basement membrane due to the particular selectins, that is the cell adhesion molecule, which malfunction here. The second feature is presence of more than one layer of cells having a basaloid appearance. Normally, the basal cell have the basaloid appearance. When the suprabasal cells also have the basaloid appearance, then it could be a feature of dysplasia. The next feature being increased nuclear cytoplasmic ratio. Normally, the nuclear cytoplasmic ratio varies from 1:5 to 1:4, but in cases of dysplasia, it could raise to up to 1:1 due to the increase in size of the nucleus comparatively to the cell. As we saw earlier, dysplasia also affects the architecture or the arrangement of the cellular epithelium. There is a change in the shape of the RETE processes. Drop-shaped RETE processes are seen in dysplasia, and also irregular epithelial stratification is seen. Mitotic figures which denote mitosis taking place are usually seen in the basal layers of the epithelium, but in dysplasia there is an increased number of mitotic figures. Sometimes abnormal mitotic figures are also seen, and also the presence of mitotic figures in the superficial half of the epithelium is seen, which is usually abnormal. Cellular pleomorphism is seen. The term pleomorphism denotes variation in size and shape of the tumor cells. The extent of pleomorphism usually correlates with the degree of dysplasia. Nuclear hyperchromatism is seen. Characteristically, the nuclear chromatin of the malignant or neoplastic or dysplastic cell is increased and coarsely clumped. Due to this, there is increase in amount of nucleoprotein resulting in dark staining nuclei, referred to as hyperchromatism. Like the increase in nuclear chromatin, there is also increase in size of the nucleoli, and therefore the nucleoli appears enlarged. But there is a reduction in the cellular cohesion. Cells are relatively loosely packed and arranged, which causes in the loss of superficial epithelium, which can be removed by scraping off, which is used in exfoliative cytology as a screening test for cancer or dysplasia. The stratum spinosum or the prickle layer of the epithelium contains keratinization of single cells or group of cells in dysplasia, which is abnormal. These are the 12 features given by Kramer to describe epithelial dysplasia. These features are also common for neoplasia conditions. But the line which divides dysplasia and neoplasia is very thin. Anytime dysplastic features can cross over to being neoplasia. When the stimulus is not being considered or removed or attended to, it could result in neoplastic conditions which is irreversible. Therefore, it is necessary to intervene in the stage when dysplasia is noted. Neoplastic conditions, along with these features, there is an increased or accelerated cell division or growth phases seen, which results in invasion of the nearby cells, nearby region, and also spread to other regions, which is known as metastasis.